interesting what we're talking about this morning, but what would we do in a situation when there are 30 overdoses in a local area? First of all, how do you find out about it? How do you coordinate that local response? And also, speaking more to our remit, how do you then facilitate information sharing across a country to support harm reduction? My name is Ed Broadbent. I'm the project manager of Prompt Response Network, which is a project run by NCCRED and funded under the Department of Health and Aged Care. Ooh. So in relation to that anecdote I was giving at the beginning, I want to provide some context as to why we exist, how the PRN was formed, and what we are doing. It was designed as a health-led and lived experience informed network to reduce harm related to emerging drugs. This need became especially apparent with what was going on with ice or methamphetamine a few years ago, in the idea that there was anecdotal data being shared, but there was no coordinated system to facilitate that. And that is the space we're starting to fill. So the PRN facilitates network formation, information sharing, knowledge exchange, capacity building, and the development of some of the systems that we're going to be talking about today. So broadly, one of our biggest problems in Australia is that we exist in a federated country. What that means is that each of our jurisdictions have different rules and governance, funding, and communication pathways that make a response communication quite complicated and fragmented. This ultimately leads to delayed responses and diminishes the effectiveness of some of the harm reduction efforts that would be going on. So our response as the Prompt Response Network in the initial part is to bring together some of the organizations involved, currently 84 organizations and agencies that represent a broad collection of what is going on with emerging drugs for people from peer orgs, harm reduction, research, etc. With the idea that if we can facilitate information sharing and knowledge exchange with these people, that is one of the initial steps to supporting reduced harms for our community. Because of this federated nature that we have, information often doesn't get shared at a national level quite easily. And one of the ways that we are able to support this is by providing a national overview of what is going along with emerging drugs, specifically with alerts. So what we do is connect with the jurisdictions to facilitate a communication pathway so we can understand when some of these reports are coming out. We are then able to then facilitate sharing of that through the Prompt Response Network. I won't go into some of the detail in this table. A few key points. I think we've already heard the increasing prevalence of nitazines. There was a large amount of MDMA drug alerts. And increasingly, we're seeing how important drug checking data is to inform this preventive health-led response to emerging drugs. In regards to those drug alerts, we have now republished 43 government drug alerts and 29 community notices. I think this is up to until September in the last year. This is quite useful in allowing that national overview. Sometimes that information really doesn't go across jurisdictional barriers. Drugs don't pay attention to borders as much as governance do. So one of the great ways that we are able to do is to share that information and then be able to share it with specific stakeholder groups to facilitate response. One thing we've done recently, which I think has been quite useful, is facilitating an RSS feed, which is some old technology that basically allows us to reshare that feed on other websites. That's been taken up by the Alcohol and Drug Foundation and AVIL. So that information is getting in front of people that need to see the information to keep our community safe. On that, there's a drug alert list that's publicly available if anyone else is also looking to connect with that information. The other component is knowledge exchange. So I think some of you people may know more than I that people change hats, move roles, and information somehow gets lost as people move around in the sector. And the idea is that we want to hold on to that knowledge to support best practices within the community. And so we have created the No Community, which is a closed platform for people to talk about emerging drugs and share knowledge. It has a few components. There's a live feed, which has things like drug alerts and reports. There's forums to discuss things like nitazines or emerging other topics. There's discussion groups, so that's used to facilitate closed conversations within our jurisdiction leads or open conversations about anecdotal reporting. And then there's other resources that we'll see. EDNA reports, which we just heard about recently, and some of the drug checking reports are available there. So everyone can kind of have that one-stop shop to stay up to date with what's going on with emerging drugs of concern. At the moment, there are 292 users, and we're hoping to continually use that platform and facilitate knowledge exchange and its use more broadly over time. Lastly, I'll just cover briefly, I'm not sure how I'm going with time. There are a few components we're doing to help build capacity. One I'll talk a bit more broadly is the National Signal Register. So if you're thinking about health data toxicology that exists in state systems, that's not accessible to people in other jurisdictions. So we're trying to make that interjurisdictional platform to facilitate informational exchange so there's an informed response to emerging drugs. That is an interesting data governance thing to go through, which requires some finesse in terms of discussing what each jurisdiction needs and what is required of data custodians and the security requirements to access that information. Jack has already talked briefly about his anecdotal reporting system. He's also doing some great work regarding risk communication, and that will all feed into making sure the prompt response network is evidence-informed, health-led, lived experience informed, and realistically supporting harm reduction relating to emerging drugs. So thank you for that. If anyone is interested in connecting to those drug alerts, they can sign up through social media on the website. If you're an organization that could potentially share the drug alerts through the RSS feed, please contact me. Otherwise, we're here to support harm reduction at a national level. Please be in contact if you're interested. Thank you very much.